Welcome, everyone. My name is Mary Rhodes with At Home by Hunt, and today I'm going to go through a webinar that explains our program. It's a pleasure to be able to offer this to you via Zoom. However, when we're done, if you have questions, my contact information will be up in the program, and I will be glad to go over any questions you may have. You can reach me by phone or email. And again, my name is Mary Rhodes. I'm the Executive Director of At Home by Hunt, and welcome. I'm going to go ahead and share my screen now for my presentation. So At Home by Hunt is a revolutionary program in long-term planning, and we're going to go ahead and explain that to you. Housekeeping items, because we're not live today, I won't review this. However, what we will talk about is my intro and then some of what your choices would be, what exactly At Home by Hunt is, what we provide, what the costs are, and some next steps if you're interested in hearing more. So just so you know a little background history, At Home by Hunt is a piece of Silverstone Living. And within Silverstone Living, there are actually three companies: Hunt Community, the Huntington of Nashua, and At Home by Hunt. Both of our communities are continuing care retirement communities. The Hunt has actually been around over 100 years. However, the Huntington of Nashua was established in 2004. What we recognized with our two communities, however, and as part of our mission is, many people came to look at the communities, but they said they just weren't ready to move into a community. They didn't want to be in a communal setting. They were happy with their own homes, happy with their network, happy with, their activities. And with that foundation, At Home by Hunt was started in 2011. So At Home by Hunt 2 is a 501c3, which means we're not for profit, along with our two communities. At Home is regulated by the New Hampshire Department of Insurance, so we're regulated very stringently. And as you can see, with our history of well over 100 years, we do have a lifelong commitment to aging. So it wasn't raining when Noah built the ark. And how true is this? As we plan our lives or as we go through our lives, we've planned everything. At least I have. You think about where you want to go to college. Are you going to get married? Are you going to have children? What home are you going to buy? What your investment portfolio is going to look like. When are you going to retire? So, we spend a lot of time planning as we go throughout our lives. So when we, start hitting retirement age and older, we have to spend some time thinking about what is it that we want in our golden years, in our older years. So the fact that you're here today speaks and tells me that you're planners. So thank you. And we'll just go ahead and tell you a little bit more. So the reasons we plan, first and foremost, financial protection and preserving your assets is usually vital for people that are looking at my program. Once you really understand the cost of care and what At Home by Hunt will allow you to really budget your care, because you're buying care at today's cost. And it's a very interesting concept, but you will see we will help you protect and preserve your assets. You don't want to be a burden to family and friends. Many folks that join At Home by Hunt have taken care of a loved one in the past. I speak from experience. I cared for my own parents, both with dementia, my dad with Alzheimer's, and they lived with us about 10 years before I had to place them. My mom actually went into assisted living first, and then my dad. But, as I undertook that, I was working full time and my parents were still highly functioning. Never did I think or consider that I might get to a point in my life where I'd have to give up my job to manage their care. And that's exactly what did happen. So for me, I know from experience that although I wouldn't change my experience with my own parents, I wouldn't want to put my children in that position. So I would plan a choice that would hopefully take that burden away from them. You want access to quality care if needed. And this is really something hard to think about because, typically if you're looking for care, you're not at the top of your game, right? I mean, even if you have long term care insurance, as that policy starts to trigger, you're deficient typically in three activities of daily living. So that might mean you need help dressing, bathing, and maybe eating or preparing food. With all that being said, your ability to really vet and get qualified help into the home diminishes. I mean, you're just not really able to manage that. Part of what we do is take that away from you because we're managing and coordinating all of that care for you. If you're here listening to me today, I hope you want to stay in your own home because that's what we'll try to do for you as we manage your care. And as you age in place within your own home, we'll get the care in there to support you as you age. And hopefully, this program or you're planning because you really want peace of mind to know you've laid out a plan and everything is going to be okay. And you're reassured that you have that care coordination and a team behind you that's going to manage what you should need in the future. So, truthfully, about 70% of seniors are going to need some type of long term care at some point in their life. Now, this doesn't mean that you're going to need nursing home care, but you might need short term skilled stay for rehab. You may need a visiting nurse coming into your home after a surgery, or you might need home physical therapy after a surgery. So, that's a pretty big percentage of people over 65 that will need some type of help. So realize as we start to age and head into the mid 60s, we need to be thinking about what our future could potentially look like. So, what are some choices? I like to say the first choice is always just to do nothing. And a lot of people I talk to choose to do that. I mean, that's okay. It's a real valid choice. What I try to explain to people is that's often the most expensive choice because if you do nothing, you may say to me, gee, my mom lived to 95. She never needed anything. I think when we look back at the aging process of mom at 95, you probably may have been running errands for her or maybe a neighbor taking her to doctor's appointments, following up on doctor's appointments. There are a lot of things that are involved for those of us who do nothing. In fact, oftentimes, if you do nothing, you might do a little bit of everything on the list. And so that often is the most costly choice you can make. Certainly, I don't need to talk a lot about Medicare and Medicaid. Medicare is those short term skilled hospitalizations or rehab stays or VNA visits to the house. And Medicaid is certainly for folks that are at a poverty level. We talked about relying on family and friends. That's a valid choice, and it might be your choice. But for me, I know realistically, it's not something I would expect my children to do for me. You could self-insure, and I think that's a wonderful choice. However, remember, we talked a little bit already about vetting those services when you need them. And are you really feeling like undertaking that as part of your process when you're not feeling well? Long-term care insurance, about many of our members who join are planners, and they do have a long-term care insurance policy. So I want you to really think about us if you have long-term care insurance, and we will work with that policy. And I'll go in a little bit later for folks with long-term care insurance and tell you just how we work with your policy. You may be interested in looking at a continuing care retirement community. And part of what I do is say, please, yes, look at everything as part of your journey of choice. Come to the Hunt or the Huntington, or if you're on the Seacoast, you might want to look at a community there. Certainly Riverwoods, is a lovely community out on the seacoast, or communities, I should say. But part of your process is really discern what's going to work for you. Typically, our members may have looked at the community and just say, I'm just not into communal living yet. And, it's not really an option for me. Of course, there's assisted livings and nursing homes. I don't know too many people that aspire to choose one of those options for their long-term plan. However, if you don't pick something, that is a possibility for you. And then lastly, of course, it's a continuing care at home program. And that's exactly what At Home by Hunt is. So what is it that we actually provide? And so the benefit of joining our program is you have the continuum of care in your own home. So it's like a continuing care retirement community, but you live in your own home. And so it offers you the financial protection that you're looking for, security if your health changes, because once you're a member of At Home, you've purchased life care, which means we are in it for the long haul with you. We're going to manage your care from the point you become the day you sign your contract until your last day. So you can rest assured that all of that care and everything in between, all your wellness is going to be managed by us in our relationship you build with your care coordinator. So that we speak about the care coordination and management. We'll talk more about that. And the lifetime coverage, I already mentioned that. So At Home by Hunt really gives you that protection with your own home of knowing, gee, I'm set. So right now there's about 35 continuing care programs across the United States. The first program was Friends Life Care, and that was started in 1985. They have well over 2,000 members. At Home by Hunt is the only continuing care program in New Hampshire. Currently, we have 115 members. We're set to approve 4 more at the end of the week. So we're working hard with growth. As you can imagine, this concept was new in New Hampshire when we started way back in 2011. So it was a very slow grow, but now we're really getting a lot of feedback and a lot of personal growth in the programs growing because of word of mouth from our members. Oftentimes we'll do a member guest webinar, or when times allow, certainly a live meet and greet with members. So our potential members can meet with folks that have already made the decision to be part of the program. And if listening to this, that might be something that interests you, I'm happy to set that up for you. Our members are really always glad to talk to anyone who's trying to make a decision about whether or not our program would be right for them. So our average member is in the mid-70s. I will tell you our youngest member is 67 and our oldest member right now is 93. Our oldest members did join in their 90s. So it's just a matter of what you feel comfortable with as you make a decision about your long-term needs. Everyone is ready at a different age. So a majority of our members are college educated, not all, but a majority. About half are married when they join. So yes, we do have a lot of single members. And for those folks, whether it's they've never been married or they're divorced, some have no children, some are the end of the line. Myself and my care coordinators really become their person. So we really identify with those people, develop a relationship, and really are able to guide them through the aging process. And certainly that relationship is built over time. We don't come in and throw ourselves on you, but as time goes by through your membership, you really develop a strong relationship, not only with your care coordinator, but with the whole team. So I want to stress that it's something that's built because we're really watching you and encouraging you to stay well. So when you join the program, you need to be healthy. So we work with you to keep you healthy. and then recognizing as you're aging, you may need services long before you do. And I can really speak to this, more often than not. We recognize a member. We have a member right now who is widowed. His only child has also passed away ahead of him, has an elderly sister that lives in New York City, and he lives here locally. And we really are watching him very closely because we feel like we'd like to put in services. We go by weekly and do check-ins and make frequent calls for him to encourage him and just talk about life in general, and really keep very close tabs on him and are talking about care with him. He's not ready yet, but we're on top of it and ready when he says he's ready. And we're keeping a very close, watchful eye on him. So yes, those are the types of relationships we build with our members, supportive, trusting relationships that really are invaluable. I spoke about the long-term care insurance, but just about 35% of folks joining do have insurance because they're planners. And many have cared for loved ones, and we already spoke about that. So eligibility. To become a member of At Home by Hunt, you have to own a home and be a resident of the state of New Hampshire. That is first and foremost. Secondarily, you have to be at least 62 years of age. I already talked about the average age, but 62 and older. We do a medical assessment, which consists of looking at 2 years of your medical records. So those medical records tell a story. Typically, it's kind of reads like a book. So if you're have high blood pressure or insulin dependent diabetes, we can see how you're managing along. And so those types of chronic illnesses wouldn't exclude you from membership. What would exclude you is if in those 2 years we read along and saw, gee, you're not taking your medications right. The doctor is always, following up, you're really not taking care of yourself. So those are things that we look for when we review your medical records. We fully recognize if we're looking at someone, in their mid 60s and older, that you're going to have those chronic conditions. Listen, we all do. I have, high cholesterol. So we have to be cognizant of that. And so, again, it's a story your medical records tell us that we're really looking at as we are looking at underwriting your medical. Also, as part of the process, we look at your financial portfolio. So we have financial application that also asks for last year's taxes. Because we're looking at your financial assets, I will disclose that we will give you 2 years of Hunt Communities, and that includes At Home by Hunt audited financials from our actuaries as part of the process. And I encourage you to review those and look through those. If you want to give them to your financial person or your attorney, that's also welcome. Oftentimes, I know many members find the break-even point for them as they're, kind of making a choice about the program. But yes, that's available to you. So no, you have to be 62. You have to be healthy. You cannot be in the need of care. We're going to look at your financial piece. As a member, you would maintain your own medical insurance and whatever supplemental insurance you have. Exclusions from the program would be any neurological diseases such as Parkinson's, ALS, MS, Alzheimer's, any cognitive, diagnosed cognitive issues, any neurological degenerative diseases would be an automatic exclusion to the program. And that's basically because we realize with those types of diagnoses that your potential for needing care can come around quicker than our actuaries have accounted for. So what is it that we actually provide with At Home by Hunt? The personal care coordinator, And you can see my team here. Pam is in the pink shirt, Diane's in the middle, and Kelly's on the end. Pam and Diane are both nurses with almost 30 years experience. Kelly's a social worker. I myself am an RN. I graduated from Northeastern University in 1988. So a long time ago. Every time I say that, I think, how could I have been a nurse that long? But it is true. So between the three nurses, we have well over 100 years of experience to pull from. I was a critical care nurse, and I was also a director of nursing in a nursing home and a regional nurse for an assisted living company. So I have a very varied history in nursing. So I like to give comfort to those who are looking at the program that you have a lot of experience to support you as you age in place. So we really develop that relationship with you and get to know you when you're healthy. We're only a phone call away. Actually, one of us always has an on-call phone. So anytime you need something, you're going to get one of the four of us to answer the phone, which is reassuring. We, as I mentioned, promote wellness, and I'll speak more about what that looks like. But as you start to age or need services, and whether that's intermittent, you might have a total joint replacement and need someone in the house for a couple of weeks, a couple times a day, just to help you over a hurdle. Or you might get to a point where you need someone on a consistent basis. We have people now getting anywhere from 4 hours a week to 24/7 care within their home. So yes, the program does cover all of that care. We coordinate it. We make sure those people are going into the house. We take away the calendar of care, and we really work that and know who's going in, and we're consistently monitoring that. And yes, I did say whether you're getting 4 hours of care a week or 24/7, the program is paying for that. So I think that's really important to remember too. And as care coordinators, we're guiding and advocating for you. I can't begin to tell you how many doctor's appointments I've been to with my members just because they want me to sit there as another set of ears. I often go to appointments in Boston with my members to really be present. I'll talk about an appointment I went to just last month down to Boston with a member who has developed some cognitive issues. He and his wife had an appointment with his neurologist at Mass General. I'll go so far as to say his wife stayed in the car on the phone because she valued my opinion so much. She wanted me to go to that appointment with her husband. And she was on the phone and we worked the appointment together, but those are experiences you can expect if you decide to become a member of At Home. So wellness benefits are, I think, are very important. Of course, it's during COVID and we've been here for a year, so what we've been able to do has changed. However, my team has done a great job at promoting wellness throughout this. Typically, we have live social events and wellness programs and educational seminars, but now most of this is done on Zoom. So whether it's discussion groups or book clubs, um, exercise classes, yoga classes. We do this during Zoom and have been. We really took off with steam as we recognized we were in for the long haul with COVID, and our members really have enjoyed the concept of being able to join if they want and not participate if they don't want. But those opportunities are present for them. And also, you know, part of it for us is really keeping in tight contact with our membership. You know, as you join and you're healthy, our commitment is we'll be in touch once a week because we're just getting to know each other. But as that relationship evolves, you know, you heard me say that some of my members I'm their person. So I have a relationship with them. If their cat doesn't feel well, they're letting me know. So I think it's important to know that every relationship is different, and we really take your lead as we develop that relationship with you. Another great benefit is OSHA Lifelong Learning Institute, which is a senior adult learning concept, much like RISE. We will pay the yearly fee for your membership, which is $40, and you can sign up to take virtual classes with them. Certainly, those classes were live in the past, but with COVID, they've adapted as well. We have a referral service for needs in your home because you're maintaining your own home. So if you say to me, gee, Mary, my plow driver moved to Florida this winter, can you suggest someone? I have a vetted list of contractors that we can offer you. We do a home assessment as part of your onboarding for At Home by Hunt to assure that your home is appropriate for aging in place. And lastly, all of our members have the opportunity to say, I want a personal emergency device, or the button, however you want to call that. And we do have a number of members participate in that and want that device as a security benefit for them. And really, that's almost a $600 a year benefit. So all of that is included once you become a member. So what type of medical services are included with your membership? Well, it's temporary or permanent local credentialed help. So that might be a home health aide, it might be a companion. As you heard me say, it might be 24/7 live-in care. It might be assisted living or memory care, and it could be nursing care. So I want you to know, once you become a member, all of those benefits are included in your membership. So again, if you needed someone 1 day a week for 4 hours a day, we coordinate that, we plan it, and the program gets the bill and the program pays for that once you're a member. If you need someone 24/7, it's the same thing. We coordinate it, we plan it, the program pays for it. So let that resonate a minute. And then if we can't manage your care and home anymore, you have the opportunity to come into the community, and that's included as well. So if you need care that can't be supported safely in your home, you can come into the community. Certainly the Hunt or the Huntington. However, I fully recognize I have a lot of members out on the seacoast. So if you needed care there, Webster at Rye is also a not-for-profit, so we work with them. And also Wentworth Senior Living in Portsmouth is another not-for-profit we would look to for placement for you. So we wouldn't expect you to move away from where you're comfortable or where your family is. So this is really the true question. Do you plan or you don't plan? I mean, you're here, so I'm thinking you're a planner. And many of you, I think we're going to talk about what the costs of care are. They do say about 58% of seniors underestimate the cost of long-term care, and just over 30% underestimate assisted living. The prices are staggering. So here is some local examples of what the program currently is paying for care. For a home health aide, what I need to stress now is, on the average, we're paying $32 an hour. You can't hire for 1 hour, though. You have to hire, they do blocks of care. So typically an agency, they vary a little, we'll say 3 to 4 hour blocks. So you have to pay for that whole block. And so if you were at home and needed someone 4 hours in the morning to help you get up, get going, get dressed, cleaned up, breakfast, and then reverse it at nighttime for dinner, getting ready for bed, that would be a total of 8 hours a day. You can see the cost of that would be almost $85,000. Staggering. That's not 24/7 care. That's just for 8 hours a day. Now, assisted living without any memory care is just under $75,000. I do have a member living in assisted living now in Nashua, not at my community, and this price is actual. It's just under $115,000 a year that the program's paying to support him there. But as a member, that is a benefit. He did not have cognitive issues when he became a member, but developed them along the way. His wife really wanted him to be in a memory care community versus Hunt community. It was actually closer to home for her. So that is what we have done for them. And then, of course, nursing care can be upwards of over $150,000. Now, if you're looking at $150,000, you're self-pay, so that's for 1 year. Oftentimes, that's not for a private room. You're sharing a bathroom. You may not have a shower in your bathroom. You might have to go to, more public shower areas. So it's a lot to think about, the cost of care. Those are staggering numbers. And how quickly could you depreciate if you're said you're going to self-insure, how quickly you depreciate your savings if you get into this situation. So how we work is there's a one-time membership fee, and that fee is based on age. I'm going to give you some examples on the next couple of slides of what that looks like. There is a daily cap for At Home by Hunt. So right now it's $375 a day, which equates to just about $136,000 a year. So that's what you're entitled to within your cap. Now, you just heard me say that a nursing home is $150,000 a year. So you're saying, well, you wouldn't cover all of it. If you decided to move into a community, or if you were getting up to the cap and going to exceed that cap, our contract says that you have the option of paying over the cap for your care, or you can move into the community and your care is covered by the cap. So you have an option never to go over your cap. But if you're going up and over the cap, that's an option to move into the community. And that's a discussion we would be having. And what I like to say, if you're heading up over the cap, quite frankly, we might have a discussion, do you want to move into the community for care regardless? So, but those are discussions we have because, again, we have that relationship. We're working with you. We're honest with one another and we work together. So right now there's a predictable monthly fee of $562 a month, and that's for a single person. If you are a couple, the rates vary. There's a discount for couples. So if you're listening to this and you're part of a couple, your monthly fee would be less. So that's important. That would be a question you could ask me about one-on-one. So here's an example of our contract. We really have one contract, and it's called the Advantage Plan. And you can purchase the Advantage Plan one of two ways. The first is the most common, and that's the 2% amortizing. So, excuse me, if you're 74 years old, your initial one-time membership fee would be $58,800. You pay that once. After you sign your contract, every month, that amount depreciates by 2%. That's what the amortizing 2%. It's like a car payment. You pay down to zero. Eventually, after 50 months, that membership fee would have depreciated to zero. Okay? And that's just a chart to show you that. Now, the other way you can buy the same contract, they cover the same thing, is with the 50% refundable. So the 50% refundable at 74, you pay considerably more, $97,100 versus the $58,800 for the same age, okay? The monthly fee is the same, the service is the same. All of the 50% refundable does differently for you is it says that at any point within the contract, you're guaranteed 50% of that money back, even upon death. So you get 50% back at any time with the 50% refundable. With the 2% amortizing, there's no death benefit. So if you pass away, whatever is not amortized does not come back to your estate. That's probably the biggest difference. So it's just the lack of the death benefit that decreases this initial membership fee. But other than that, both of these plans depending on how you choose to purchase it, provide the same amount of care. So we're back to this cost of care chart and, these staggering numbers. If you plan ahead with At Home by Hunt, you can budget for your health care. You know that all of your long-term care needs are going to be covered by this $67,444. So your budget for that, and then you're never going to be hit with these staggering costs of care. And you're also going to know that you have someone that's going to coordinate, vet, advocate for you along the way, and make sure you're getting the best of everything that you deserve. Because when you're not feeling good, doing all of those things gets a little tricky. And I often say, it's very difficult to quantify that. But I can certainly put you in touch with members who are experiencing care right now, or have their husband or wife getting care right now, and we can have them talk about that experience if you want to listen to the value or hear about that value, because it's very hard for me to quantify that for you. So if you have long-term care insurance, this is important because we work very well with that. And everyone's policy is different. So what we do is we look at a number of criteria within each policy. So we have something called a long-term care calculator, and I'll show you an example of that. But what's important to know is At Home by Hunt is the first payer until your long-term care triggers. So for example, you're a member of At Home and you joined with your policy. If your policy reads, and more often than not they do, that you have to trigger 3 activities of daily living before we could trigger that policy, you might be receiving care long before that policy is triggered with At Home, because with At Home, you only need to have a deficit in 1 activity of daily living before that policy triggers. So you're getting that gap covered, completely covered. I also want you to remember that typically with a long-term care policy, there's a 90-day elimination period that you have to wait to trigger that policy. We're going to pay during that policy, so you don't have those out-of-expense costs. Those are 2 really huge benefits. So we're really filling in the gap. So when you join with long-term care insurance, you have to keep your policy. That's part of our contract. So this is what it would look like. And the calculator looks at the same criteria of every policy, recognizing that everyone's policy is different. So it looks at gender, age. You can really read this: elimination, benefit period, what your coverages are, the maximum benefit, does it have inflation, is it standard or compounded? Our actuaries built this for us, and what it does is it gives us what your discount off the monthly fee would be. So you heard me say our monthly fee was $562. If you get this policy would allow you a $266 discount. You can see your total monthly fee would be $296. And again, that's for the same amount of care with that Advantage contract. It's just at a discounted price because you already have your long-term care insurance. And that's why so many people with long-term care insurance are purchasing this, because they are really planners and they do want that gap coverage to know they're completely covered, and have that self-assurance that they have this team, these care coordinators behind them, really focusing on their wellness and eventually any care that they would need. So new to At Home, or this is a new updated version of a bridge program. If you are a member, what I recognized is many people want to stay at home right now, but as they age in place, we all change our minds. That's a normal human thing. How we feel about something might change. So you might join in your mid-70s and say, I never want to leave this house. but something might happen in your life. Maybe you lose a spouse, or maybe you've had an illness that's really scared you, and you say, you know, I've decided I want to live in the community. You can bridge into the community as an at-home member. And what that means is when you bridge into a community, you're still healthy. You heard me say part of the program includes nursing care, and it does, but that's if you're in the need of care. If you're still independent and you want to move in, you bridge over. The program will give you 75% of your initial membership fee, regardless of where you are in the amortization of that fee. We're going to give that towards your apartment initiation fee. So your residential fee, I should call it. So 75% of your initial membership fee will go towards that resident fee. And we'll work you through and help you through the process of finding an apartment and moving into the community as an independent resident of the community. And because you're bridging over to independent, you signed the contract for the community, and you're not an at-home member anymore, but you're still part of our family because we're all, you saw in the beginning slide, we're under Silverstone, we all work together, but your life care would be covered then by the community. So I've had actually coming up, I will have 4 members that have bridged into the community already. I have another couple looking to bridge into the community. So there are advantages and there are things that happen in life where people change their mind. I think this is really good for people because it gives you an option. You have the knowledge to know, okay, I'm paying that membership fee, but if I ever change my mind, they're still going to give me 75% of that to move into the community. So I think it's an option for people. And I stress this was, I think it will be my legacy with At Home. I worked hard last year to make sure that this happened. And it's really nice to see it come to fruition and see some of my members taking advantage of this. So this will be there for you as well. We're getting towards the end, but I can't forget this because we are at tax season. 100% of that initial membership fee is tax deductible, and about 70% of your monthly fees are tax deductible. We do a yearly actuarial study of our numbers just to make sure our pricing is right. So you can be self-assured that we are guided by our actuaries with our pricing to make sure that our margins are correct, and that we are, you know, in the right spot to make this program solvent for many years to come. But they also provide us with a letter every year for our membership about what they recommend for tax deduction. Now, we're not tax attorneys, so we always provide this letter, and as part of your tax portfolio, you can give it to your accountant or tax attorney. But this is true and what we would recommend. So next steps. I would hope that, you know, I've said something that would cause you to want more information. If it's your first time listening to me go through this, it's a little overwhelming, and I'm sure you do have questions. So I welcome you to reach out to me. I can get you any information you want, whether that's the disclosure statement with our audited financials or a copy of the contract for you to review. Certainly as part of the process, I'm happy to do that. I'm happy just to spend some time talking with you, answering any questions you might have. There is that financial and medical application. If you decide to apply, if you're a single, it's $300. A couple, there is a $350 charge. And as part of that process, certainly you'll meet with a care coordinator. As I said, I'm not a salesperson. I've been a nurse a long time. My salesperson left about a year ago, so I just started doing the presentations because it really is something I am so true to. I really feel really strongly about the program and the benefits for our folks. So I think people value my opinion. And I'll help you walk through. I clearly recognize at home is not going to be for everyone, but if I can help you on your journey to deciding what is right for you, I'm happy to do that. So you can ask me questions as you go along, and I'm happy to answer. Well, I won't talk about the survey because this is taped, but what I will talk about is right here. Again, I'm Mary Rhodes, the Executive Director of At Home by Hunt. It's been a pleasure to present for you today. You can reach me at mrhodes@athomebyhunt.org or 589-4120. And I'll look forward to hearing from you at your convenience. I hope you enjoyed the presentation today. As I mentioned, it was my pleasure, and I wish you well. Thanks for joining me.